In Israel, we can speak, let's say, about 4 different phases. We had the first one, of course, preventing cases entering Israel, but I think the first phase was mainly characterized by uncertainty, lots of questions, fear. Maybe some of their actions were a bit drastic. Only later we realized how we can react in maybe a bit more proportionate manner, and also established the different expert committees. We learn how to raise the number of tests, and to do things that are, again, more proportionate. But I think that gradually we saw more and more, unfortunately, the connection between our very unstable political situation and decision making. I'm a member of the expert committee. We advised for the what was called the traffic light system that started to think in a more differentiated manner, and also to think about public health, not just about counting cases of COVID, but being more balanced. And then it took, several months until our suggestions were adopted. And then it was a bit late, and we need to enter another lockdown. Then we had the UK variant. And I think in the last few months, Israel entered into mass vaccination, and we see now the results. Israel is almost back to normal right now. And although we are still doing surveillance on different variants and issues about people entering from a national airport, we are in a much better situation. But I think we cannot forget the need to strengthen our public healthcare system. Remember that it's a marathon. We have many long COVID cases, and the mental health, the economic, other social aspects are extremely important. And also to see how we are going to deal with the stressed, overworked, even traumatized healthcare community. I think that's something that we must remember now, and also the health inequalities that were created in Israel, and how to regain again the trust of the different communities, and using solidarity as something that in Israel maybe is more common than in the US. I know in the US sometimes the word solidarity has some political or historical connection, but I think we need to see how we can regain trust and solidarity. Of course, solidarity is not a magic word, because sometimes solidarity can be only those that are similar to us. I'm talking about a broader meaning of solidarity. And public health is something that is not just about protecting us from them, but it's also about human rights and health equity.
And this question is also for you, Professor Davidovitch. We know that the Israeli health system is different than the American health system. Can you share just some key differences, key characteristics about the Israeli health system?
Sure. I think that probably the most important one, that we have a single payer system. We have a national health insurance law enacted in '94. These are exactly the year that Hillary Clinton was trying to do something similar. And I think what is incredible, but with all the political struggles, in Israel, both the right and the left are supporting a strong public healthcare system and a national health insurance law. It was approved both by Likud and Labour Party in '94. Now it seems like science fiction almost. So we have 4 non-profit health funds operating the system, a very strong community healthcare. And I think this is the main reason why, although in some part of the pandemic we had maybe the highest number of cases per capita, if you compare the death rates, they were much lower. And also during the vaccination campaign, having such a strong public healthcare system with a very strong electronic medical records, and a good balance between the Ministry of Health, giving guidance, and the healthcare, the health funds, operating, mobilizing nurses also to the community, with lots of help from what is called Magen David Adom, the equivalent of the Red Cross, to get into communities such as elderly homes. This whole flexibility of the system, but a strong public health system was very important. And also the fact that vaccination is integrated into Israeli culture. So I really suggest a lesson that I hope will be learned other places: strengthen your public healthcare system. Otherwise, you're going to have a very fragmented response that, especially in cases of emergency, I think also not only in emergencies, but especially in emergencies, it will be very problematic. And finally, having a public healthcare system is saving a life, and it's more efficient also.
This question is to everybody on the panel. So we know that this past year has been very difficult. Natasha, can you start talking about some challenges that we dealt with in COVID-19 and how we overcame those challenges?
Sure, absolutely. Thank you, Rachel. So from an emergency management perspective, I think our first and ongoing challenge was the staffing. We found ourselves in a very rapidly evolving situation and needing to pull from our resources a pool of individuals who could do things like open a complete testing process in an unfamiliar environment, using whatever resources we can pull together and collaborating with new partners that, while we were familiar with them, this was brand new. So we had a lot of staff who were torn between their personal needs to make sure that they were keeping safe, but also put into an unfamiliar environment and said, we are going to do testing. And we had them out there for months as we worked with our partners until community resources became available. So we were able to adapt very quickly. We were able to leverage resources from the system. It also taught us a lot about developing teams going forward for the next catastrophe and trying to understand really what we would need to do. We did a similar process, again, with staffing challenges with vaccination, when we again found ourselves in an unfamiliar situation, unfamiliar locations, and having to find staff that would be able to adapt to the new environment with many unknowns. As you know, with the vaccines, things change from eligibility to our ability to open enough hours to reach out to vulnerable populations. So I think that's something that we were able to adapt. We were able to evolve as the situation changed. But moving forward, we also have a better understanding that these are going to be ongoing needs, and being able to develop our staff, I think, is something that we're going to continue focusing on in the future for whatever might come next.
Thank you. Dr. Macaluso, how about from a physician standpoint, any challenges that we have overcome?
Yeah, the big one, I think, was trying to make decisions and trying to provide direction to healthcare providers as well as patients in the community in an environment where our knowledge was lacking. This was obviously a new version of the SARS virus. We had to learn quickly about how it's transmitted. And then we had to develop strategies from as you well know, from a infection control perspective. And the recommendations were always evolving in those first 6 months and even to now. The knowledge base increased, recommendations changed, and then we had to communicate that. And I think one of the big lessons learned is that we may have overcomplicated the message. The messages was very confusing to people, and then we kept changing them. And I think in a future state, in the future, people only have so much bandwidth to understand how to protect themselves. And we're going to have to break it down to make it simpler, to provide risk mitigation strategies to people that they're going to understand. Human beings generally are not very good at measuring risk. We tend to fear things of low risk, and we tend to ignore higher risk things. And so I think in this pandemic and going into the future, we're going to have to do a better job at communicating a simpler message to help people protect themselves.
To Professor Davidovitch, I would like to elaborate a little bit on the Pfizer experience in Israel and how that could be scalable to the rest of the world. What was unique to Israel in the deal with Pfizer and the vaccine rollout?
So I think my answer will be also related to the challenges, and I think one of the major challenges is the question of trust. When I'm talking about trust, I'm talking about all stakeholders. I'm working on the question of trust in public health for many years now, and we developed this concept of circular distrust. So it's when you have different stakeholders, and it's not only that the public not trusting, let's say, the decision maker, but also sometimes decision maker not trusting the public. And you can create some kind of a vicious circle. Of course, trust is also related to the history of the relationship, etc. Why I'm mentioning that? Because, of course, the deal with Pfizer was, of course, part of a very crucial part of the success of our campaign, because we secured enough vaccines. Pfizer signed an agreement with Israel because of the unique characteristics, having Israel as a model country, because we have a strong public healthcare system, community healthcare system, electronic medical records. And for Pfizer, this was a way of, bringing vaccines to a place that can serve as a model country. And indeed, we see now that and showing the world that actually Pfizer vaccines or messenger RNA vaccines are efficient. They are also safe. I mean, all vaccines, all pharmaceuticals can have some side effects. But more important, they are not giving personal protection, but also reducing the risk of transmission. And there is a big discussion now in Israel, are we in herd immunity? By the way, I don't like so much herd immunity, the term. It's a historical term coming from veterinary medicine. Maybe population immunity, or in Hebrew it sounds better, but it's like community immunity. It's a better term. And we show the world now that if you are doing this vaccination campaign, especially with the right prioritization. So first of all, the high risk and the healthcare workers, and then reducing it. Now we're vaccinating all Israelis 16 and above. We have a big discussion tomorrow about children aged 12 to 16. By the way, we vaccinated about 800 of them, without those with high risk, that are high risk, and things were things went very smoothly. So this was the agreement, and Rachel, the agreement was not public for many weeks, and this created lots of fake news. Even asking, why CEO of Pfizer, why he was not vaccinated. The answer was that he didn't want to, be in favor of, of himself, because he wanted to wait until it's his priority. Finally, the agreement was given to the public, but some parts of it were remained a bit obscure. There's still the question that many people are asking, and although I'm part of the many committees and I'm signed on a secrecy agreement about the clinical data, nobody really knows, is there an agreement that Israel will vaccinate Pfizer only? Because that's what happened finally, because we had an agreement also with Moderna, another messenger RNA technology. I'm very proud to say that the medical officer is a graduate of Ben Gurion University Medical School. Finally, those vaccines were given mainly to Palestinians working in Israel. And I think that having this all vaccine nationalism is not a good idea. We see around the world a gap in vaccination coverage. This is going to cost us, according to a RAND report, more than $1 trillion. And you see what's going on now in countries like Brazil, Argentina, places in Africa, and also in our neighborhood, unfortunately, with the Palestinian Authority. All public health community in Israel are in favor of vaccinating Palestinians, both on moral foundations, but also it's our interest. We're not an island. If we want to get into this herd immunity, we need to vaccinate them. And we have now negotiation. I hope this will be solved soon. And I wish that we're going to learn how to work. I mentioned solidarity. So it's solidarity not within countries, also between countries. I'm so happy that the US is now back to the WHO. I think that we need to work all together to see that vaccines are going to be available everywhere, both within countries and between countries, and to see how the question of patents and agreements and secrecy are things of the past. I'm not naive. It's a major shift in all of the so-called market rules, but I think it's finally for the best of all of us, also from economic perspective.
So I want to stay on the vaccine topic. Thank you. And what are some, we know that some people think that mRNA vaccine is a new technology, but it's not a new technology. So that may cause some mistrust and some misinformation out in the public. Dr. Macaluso, how would you combat some of that misinformation about the mRNA technology?
Well, one thing is that, as you mentioned, the technology is relatively new, but these vaccines are not the first types of therapeutic agents that have been developed using messenger RNA technology. There have been cancer treatments, for example, that utilize it. The other is there's some advantages, really, of an mRNA vaccine, and probably a big one is that you're not introducing virus into the body to stimulate the immune response. In fact, the messenger RNA doesn't really even get into our own nucleus in our cells, and so there's really no chance of impact on our DNA. So, and it allowed for these vaccines to be developed much more quickly. I would add, and if we stick specifically to the two messenger RNA vaccines, the Pfizer and the Moderna, the type of immune response that they're producing in us is quite robust. Not only do you see antibody develop to the SARS virus, what's called neutralizing antibodies, but there are many types of antibodies, and in addition, what's called cellular immunity is stimulated by these vaccines. And so what it offers is protection even with the variants that are now emerging. Variants, it's not a surprise at all that the virus would mutate. That's normal for viruses. But what we're seeing is even in the instances where there is some slight reduction in the neutralizing antibodies, the overall response, immune response triggered by these vaccines is enough to protect us even from the variants. So those would be the things that I would talk to people about rather than the newness of the technology. Newness doesn't mean bad.
Natasha, do you have any thoughts for combating some of the hesitations and mistrust based off of what we've seen in our community vaccination pods?
I think having trusted agents involved to really bring the message out to the community is going to be very helpful. Also showing those individuals who have gotten vaccine and using really ambassadors to say, we've received the vaccine, we understand it, it's fine, it's okay, and to provide the education where the people are. So to bring it to that level of really being able to help people understand everything that they need, because there has been misinformation. Social media has not been our friend in any way. So really being able to combat it where people are, I think is going to help very much with the hesitation. And now that we've had more time and we see that there are more people in the community, I think we're definitely on the right track, but we have a lot of work to do to be able to get the message out.
Thank you. And so what about a return to normalcy? Dr. Macaluso, based on our experience on the ground here at the healthcare system, what do you think is a time frame? I know Professor Davidovitch talked about it looks pretty much normal in Israel, but what could our new normal look like, and when do you think that's going to happen?
So the when question is hard because, as I mentioned earlier about the uncertainties. A month or so ago, we were seeing some declines in the number of new cases in Florida, and we were really hopeful that by now we would see a different picture out there. But unfortunately, Florida, Broward and Dade County in particular, like some other states, saw an increase. And so the predictability here is problematic. I would say what needs to happen is a combination, and it makes perfect sense, a combination of decreasing number of new cases and an increasing number of vaccinated people. That combination will allow us to begin normalizing our behaviors. So, for the time being, being outside and socially distancing, or being outside and if you can't socially distance, wearing a mask is probably the formula for unvaccinated people. I think vaccinated people have a few more liberties that they can begin to enjoy. So it's going to be a combination of what Natasha said in terms of having vaccine ambassadors, getting the word out that this is a great thing to be vaccinated, and in the short run, just giving it a little bit more time for some of these new cases to slow down. We are seeing a slowdown in some of the other states up north that had little mini surges. Florida and Broward County are kind of flat right now. Hopefully, we'll start to see a decrease. And then again, that very safe and cautious emergence of normal life can occur.
And my final question is, what have we learned in the past year that could help us in future pandemics? Just from an infection control, infection prevention standpoint, I hope to see everyone washing their hands just as vigorously and with so much passion as they have in the past year. I do not want to see any more gloves in the grocery store. So that's something I want to take away from the future. What about you, Professor Davidovitch?
First of all, it's interesting to see that we have now some rise in so-called normal viral infections. Just spoke about it today in one of our channels, and yeah, we on the individual level, of course, hygiene, all of that is extremely important to remember. Investing in in hospitals to reduce nosocomial infections, something that is haunting all medical systems. But I want maybe to speak more broadly because there were many lessons, and I really hope that I think it would be a mistake to return to some normal and not the new normal. And I'm talking about the education system, both schools and higher education, to see how we can be smart and do some hybrid teaching. I think there are lots of exciting opportunities here. I think that we learn to cherish also outdoors and open spaces and rethinking urban planning. That's something that was a big issue before, and I think was just made even more important after all, in these stages of COVID, because it's indeed not behind us. See what's happening in India and other countries. And I think that finally, maybe it was a warning for, I think, greater challenges such as climate change, that we need to work together, that changing ecological equilibrium can lead to, major disruptions. It's already the situation, and working together on the community resilience, to see it, at least in Israel, we learned how the right balance should be between a centralized and a decentralized response, and the role of communities and community leaders, as Natasha spoke before about trust and how to bring public health, not just by kind of top-down initiatives. And again, it's a marathon because we still have long COVID, we still have really stressed and traumatized the healthcare workers, and we need to see how we're going to strengthen these aspects. And we have lots of work ahead of us. I'm a realistic person. These things are not going to happen just by themselves. It's up to us. So it's up to us, to see if we're going to do these reforms. And again, I'm happy to say that it seems that in the US, returning to the WHO, signing again the climate change agreements, I'm so happy about that, because it's, it's so crucial that the US will be leading the world on these topics. And also in a much smaller country like Israel, we also have our share, of course.
Thank you.
Rachel, along those lines, I think going forward, and there's an opportunity to teach our young people and our children how to source information when it comes to things like a pandemic or climate change being another example. The scientific community needs to elevate its voice, but we're going to, because there's such a wide range of information sources out there, some excellent and some horrible. One of the challenges will be teaching young people how to pick out the right places to find information on the right topic. So information about a pandemic needs to come from the scientific community more so than it's coming from, say, the political community. And that's a lesson that's going to be a challenge for us. But I would say that's one of the big takeaways I've had over the last year and a half.
Thank you so much to all of our panelists. I'm going to turn it back to Andrew.
Thank you, everyone. Greatly appreciate your insight and bringing clarity into this extremely challenging situation. All of you are true, in my opinion, modern day heroes during these unprecedented times. We are beyond appreciative for all of your heroism and hope, especially the hope in light of this pandemic. Now, I would like to introduce you all to a fellow board member and past board chair of the Jewish Federation. He is a board certified physician who specializes in radiology and a member of the Memorial Hospital Board, Dr. Peter Livingston. Dr. Livingston has dedicated over 30 years to the Jewish Broward community through his philanthropy and leadership. Dr. Livingston will speak about an incredible new project that he is helping to spearhead, a partnership between the Joe DiMaggio Children's Hospital and the Jewish Federation of Broward County. So Peter, please tell us about this initiative and how we can all be part of it.
Thank you, Andrew. We're very lucky in this community to have two very special organizations. One is the Jewish Federation of Broward County, which is committed to the welfare of the Jewish community, and in part of that, the health and well-being of our families and our children. The other is the Memorial Healthcare System, and particularly the Joe DiMaggio Children's Hospital. It is really a fabulous, fabulous organization. And I'll give you a few factoids in a moment. What I want you to know is that the Jewish Federation of Broward County and Memorial Healthcare System and Joe DiMaggio have had a long working relationship between us. There are warm feelings and knowledge of each of us and our professionals. Memorial Healthcare System has been a corporate sponsor of the Jewish Federation for years. And when we had the National Macaluso Games in Broward at the Posnack JCC, the Joe DiMaggio Children's Hospital provided staff at all of the venues and all of the athletic events to make sure if anyone was hurt or became injured, that there was someone there to immediately see to their welfare. We were supposed to have another National Macaluso game this year, obviously postponed because of the pandemic, but Joe D was going to provide staff and people at all the venues once again. In addition to that, when Federation knew of donors who wanted to give money to a hospital, we would send our donors to Joe DiMaggio and Memorial, and those donors have supported the institution. And finally, when the Federation learns of people who have healthcare emergencies or special response needed, Memorial would always take a phone call from Federation so that resources could be responsive to the needs of individual members of the Jewish community. That relationship has been going on for years. Now, Joe DiMaggio, for those who have been fortunate enough not to have to use Joe DiMaggio, is a huge, very sophisticated healthcare system. There are 10,000 admissions a year, 8,000 pediatric surgeries a year, 25,000 outpatient visits, and 100,000 ER visits. We're over 65 pediatric heart transplants. We do kidney transplants, bone marrow transplants, unfortunately for those who have cancer. And the Memorial Healthcare System has estimated that in a 2-year period, that 7,100 Jewish families have been treated at the Joe DiMaggio Children's Hospital. Now, the Joe DiMaggio Hospital, in anticipation over the next 15 years of another 100,000 children being in Broward County, is expanding the hospital from 4 floors to 8 floors. Now, within that system and in that expansion, Memorial and Joe DiMaggio do a lot of techniques to decrease the trauma and the emotional trauma and fear of disease in children. There are a lot of techniques we use that I will not go into, but part of the expansion is a 6,000 square foot area designed for kids and their families to decompress and seek respite from the day-to-day issues of their particular illness that brings them to a hospital inpatient. There are play areas, classroom, dining rooms, teen room, family lounges, fitness area, even a beauty salon, and an interactive TV. So all designed to make the experience in the hospital more humane and less fear and anxiety. Now, ever since Joe DiMaggio has been in existence, children who had kosher requirements and food requirements, besides other people who had special food requirements, kosher food was always available. But when you're dealing with a family and a child, and in both the adult and children's hospitals, we have family-centered care. We take care of the patient, but we worry about the family. Parents often stay a long time in the hospital with their children. We have availability to do that. But for those who observe kosher rules, there was no place to store food, there was no place to prepare food, and there was no really place in a kosher environment to seek respite. So as part of the plan, initial plan of the expansion, Joe DiMaggio is going to build a kosher kitchen. And around that kosher kitchen, a family lounge where observant families can relax and be with their children and prepare their food as necessary. The Federation was approached by the Joe DiMaggio Children's Hospital Foundation to consider a gift of $250,000 to help build that family lounge and to support the Joe DiMaggio Children's Hospital. And the Federation, after critical and thoughtful consideration of that request, the board has decided over the next 5 years to raise $250,000. Why did we do that? There are several reasons. First of all, we had a lead gift of 1/3 of the commitment by Dorit and Ben J. Janae of $83,000. The second reason was it was important for the Federation to support all aspects of the Jewish community, including the observant and kosher families. And so we wanted to contribute to their well-being when their children are in the hospital. Third, because of the relationship and the importance of Joe DiMaggio Children's Hospital to the welfare of all of Broward County, we wanted to support Joe DiMaggio Children's Hospital. And finally, we wanted the entire community that is not Jewish to know when they walk in the front door of Joe DiMaggio Children's Hospital that part of the success and infrastructure of the hospital has been supported by the Jewish Federation of Broward County, their Jewish community. And that was important to us also. Now, since we had the lead gift, and I will tell you, we're less than 2 months into this process, we have received an additional $20,000 of commitments from individuals and a $10,000 gift from Bikim Holim. So we're up to $103,333. So we're well on our way to raising $250,000. And it's important, I think, if all of us have children, they're the most important thing in our families. And for people who have gray hair like me, it's our grandchildren. They become the most important, and we don't have to do we don't have to punish them. We only have to love them and go home. So children and grandchildren are very important to us. And I would encourage you all who are listening to this to consider also supporting this effort because it makes the Joe DiMaggio Children's Hospital better, and it's already great. It also makes the resources available to our community and our children and our future community very important. So I hope you will consider this gift. And if you have any questions, please reach out to Stacy Rubenfeld at the Federation. And after I'm done speaking, which is shortly, there'll be a slide that gives you some information of how to make that decision, make a donation, or to reach out to us and think about how you can make a difference not only in the Jewish community, but Joe DiMaggio Children's Hospital. And with those comments, Andrew, I give it back to you. Talk about children.
Well, thank you very much, Peter. And for everyone on this call, I hope you all agree that the Kosher Family Lounge is going to serve a vital purpose in our community, which has been growing leaps and bounds every day. For more information, as Peter said, please contact Stacy Rubenfeld. And Peter, we are very appreciative. I am. For the last 22 years, I met you when I was much younger, and you were an inspiration for me to get involved, you and Benjay. So we're appreciative for all the work you're doing to raise the awareness and funds. And so this morning, my son and I had a conversation. It is his bar mitzvah this week. So in honor of his bar mitzvah, our family wants to pledge $1,000 towards the new Kosher Food Lounge in honor of his bar mitzvah this week. And again, we appreciate everything you're doing. We appreciate everyone on this panel for what you've done and for science and what we believe in. So I thank everyone for spending part of their Sunday with us, and I wish everyone a safe rest of the weekend. And thank you.
Thank you so much. Bye-bye from Israel.